Thank you for joining me today. My name is Dina. I'm part of the admin team here, which includes April Smith and Ashley Wojan to help you make it very easy and efficient to work with our doctor to schedule and follow through with surgical patients scheduled on an in-house basis. I hope that this overview and training helps you to get a good idea of the easiest way to work with us. And just right from the get-go here, I want to let you know that we are always here, always ready, willing, and able to help out in any way that we can. So please always feel free to reach out to us via phone or email. I will make sure that all of the contact information for our team is available to you. In order to get started, there's a couple of things that you're going to want to do in preparation for seeing surgery and sedation patients in your office. One of the things that you're going to want to do is add our doctor to your system. You will want to go ahead and add a provider to your practice management software. Enter the provider's name, MPI, and license number. The process by which to do this varies from software to software. So if you aren't able to add a provider easily to your software, let us know and we'll either try to help you out or we can recommend that you get in touch with your software tech support who would know exactly how to add a provider. Send an add provider letter to insurance companies that you are contracted or participating with as necessary. We're going to go into that in a little bit more detail in just a few minutes. Your surgery provider's NPI and license number are provided in the welcome kit that you receive from either Ashley or April. And if you are having trouble locating that, please do give us a call and we'll help you out. One important thing that we want to make sure takes place is proper claims reporting. All services are being rendered in your physical office and billed by your physical office using your office name, address, MPI, and tax ID number. The rendering provider, or the doctor who's actually doing the service, is our doctor, the surgical provider. And you will make sure that on box 52 under rendering provider on the dental claim form that that box includes our doctor's name, license number, and NPI. That'll happen automatically if the charges are posted to that doctor in your practice management software system. We strongly recommend to print and mail claim forms to the insurance company each time you have one because we have found that there's a little glitch in most of the eClaim software programs. That glitch prevents the rendering provider information from transmitting to the insurance company, and so it looks like your billing entity, your office, is also the rendering provider. When that happens, it can result in a misprocessing of the claim itself. And so we strongly recommend to just print and mail the claims with the x-ray instead of e-claiming in order to prevent those types of things from happening with improper claims processing. Really super important part of treatment planning a surgery claim for a patient is insurance verification. We want to make sure that we give all of our patients the most accurate financial information available, and in order to do so, we need to ask a few special questions when verifying their insurance. We recommend that you add to your insurance questionnaire our surgical extractions covered under the dental plan, our impacted extractions covered under the dental plan, and is IV sedation covered under the dental plan, and if so, what are the criteria? Most insurance companies do cover IV sedation for 2 or more surgical extractions in 2 different quadrants, or 1 or more impacted extraction. You'll also want to ask if a medical denial is required in order for dental to pay their portion. Don't panic if they say yes. There are a couple insurance companies that will say yes. Our team is here, ready, willing, and able to help out with that because we realize that you are not able to often convert a dental claim into a medical claim through the software system that you use. So we're happy to do that for you. One of the things that you're going to need to do for insurance companies that you are contracted with is to send a non-participating provider letter. And in order to do that, we have provided a sample letter that you can copy and paste onto your letterhead. Make sure you fill in all the blanks and send it in either in advance of your first patient or with the claim for your first patient for each insurance company. Oregon has a special process for that, and so here is the regular add a non-participating provider. Here is the Oregon add a non-participating provider. Next is treatment planning. When you initiate a referral to our surgical provider, you will want to make sure you include the services that are needing done, the patient's medical history, and their x-ray. Our doctor will then review the patient's record, and he will be able to code the extractions based on the type of positioning of the tooth. So if it's a surgical erupted or a complete bony, he will be able to provide you with those codes, preferably within enough time to be able to do a predetermination, but if not, you'll be able to verify insurance benefits over the phone at the code level. If you're wanting to give the patient a treatment plan instantly without waiting for the doctor to code it, we do recommend that you do that. And if you do, give the patient kind of the worst case scenario coding, which means go ahead and code for 7240s from the get-go, because that's about the highest fee that they could be looking at. And then after the doctor's had a time to review the case and the x-rays, if those teeth are not full bonies, he will code them appropriately. And then you get the pleasure of telling your patient, well, it turns out that these teeth aren't completely impacted, and so your treatment fee is going to be considerably less, which means that your out-of-pocket expense is considerably less. So what has happened in that case is we've gone ahead and made a really happy patient by telling them it's not going to be as expensive as we first thought because the teeth aren't impacted, they are erupted or soft tissue impacted. That way we make happy patients instead of surprising them with increased fees for incorrect coding. We're able to reduce their fee instead. In order to make a referral and get your patient scheduled, you'll need to send securely to your surgical provider a recent x-ray, their medical history form, and 2 or 3 potential surgery dates. If you're not using a secure email service to communicate this, you can use vlink or our vmail platform, which we'll go over in just a little while, in order to send that information securely and make sure it's HIPAA compliant. In order to initiate vlink, you'll do that through the internet at vlink.pro. Enter your username, which is your office email address, your password, which is provided in your welcome kit. We're going to review how to use vlink here in just a minute. There are 5 forms that you will need to have available for the doctor and for the patient on the day of the appointment. The first one you actually need in advance of the appointment, and those are the preoperative instructions. We strongly recommend that you print this out, give it to the patient when you schedule the appointment or provide them their treatment plan. Review it both verbally and give them the written format. We strongly recommend that when you call to do your reminder calls that you review the preoperative instructions. You'll also want, whenever possible, your patient to complete page 2 in advance of their appointment, which is their medical history update form. The doctor will need this form completed and signed by the patient in advance of the patient's surgery. Page 3 is the treatment record, 4 is the consent form, and 5 are the postoperative instructions. You'll also have a HIPAA form. Your front office should prepare for patients coming into the office for surgery with just a few simple steps. First one is collect any payments still due. Most offices will have the patient either pay their estimated portion in advance of their appointment or make some sort of a down payment on their appointment fees when they schedule. If there's any outstanding amount still due to collect, go ahead and collect it on the day they come in. Schedule the patient for a post-op appointment 5 to 7 days out. Prepare the consultation area with the completed medical history, blank forms 3, 4, and 5, and the surgical treatment plan from your software that shows the treatment being carried out and the fees being charged. If a patient's having IV sedation, it's a good idea to ask them to use the restroom before they come back for surgery, just in case. Your assistant will have very little work to do in order to prepare for our doctor using the operatory. We've provided a list of disposable supplies that we will use while in your office. You can get a little plastic shoebox and just put a small stock of gloves, gauze, blades, needles, the things that are on this list in the little shoebox. Write the doctor's name on it, and at the onset of an appointment, they can go ahead and pull that box out of the cabinet and put it on the counter, and then your assistant has effectively set that room up for our doctor. From time to time, you may run into an issue where you have received an EOB that's been downcoded or an alternate benefit applied, or the claim has otherwise just not been processed the way that we're expecting. In the case that that were to happen, please do not hesitate to reach out to us. We are ready, willing, and able to help out and to provide all of the documentation, narratives, appeal information that is necessary in order to reprocess that claim and have it processed correctly according to the patient's plan benefits. In addition, should you require a claim be filed to medical in order for the insurance to cover the patient's treatment under their dental, reach out to us as well, and we are more than happy to transcribe a dental claim into a medical claim form so that that's a lot easier for you guys. Narratives and appeals. Any other kind of insurance issue, you can reach out to us directly and we'll be happy to help you with that. Another frequent question is, how am I billed for the services of the surgical provider? And the way that we bill is on a monthly basis. You'll receive an invoice at the beginning of the month for any treatment that was done the previous month. You should be charged 50% of the total treatment fee, a small assistant fee, and if implants or bone grafts are done, then there is a materials fee to share in the cost of that hardware, which comes out of the total treatment fee prior to the calculation of the 50% fee. We're here to help. Your treatment or practice coordinator is either Ashley Wojan or April Smith. This is their contact information. They're happy to help in any way that they can. If there's something special that you need, you can reach out to me directly, Dina Rathbun, dina@vipsdental.com. For insurance-specific help, you can reach out to the insurance help desk at ins@vipsdental.com.